Hi guys, Dr. Pascal here with Spinal Health Distributors, and today we're going to be talking about spinal orthotics. We have two thoracic orthotics. We have the Thoracic Denneroll itself and the Thoracic Retrainer. So the patient is going to lay on the Thoracic Denneroll with the peak at the apex of the curve. Now if the peak or the apex of the curve is at T7 or above, the tail of the Denneroll will point towards the sacrum. If the peak of the curve is T7 or below, so T7 to T12, the apex is going to be at the peak of the curve, and the tail of the Denneroll will point towards the head. So we're going to have our patient lay back. We'll say her apex is at T7, so the base of the shoulder blade. She's going to go ahead and lay back. They're doing this on the floor at home, and ideally the head is touching the floor. Some patients are going to be rigid, are not going to be able to get their head all the way back to the floor. They might experience some neck pain or a little bit of dizziness. So as the patient begins to build up in time on the Thoracic Denneroll, we can have them support their head with a pillow or a towel that's folded up. Ideally, it's something that they can reduce incrementally. So here I have 3 foam blocks, right? So at first, the patient might need this much support. And as they tolerate the Thoracic Denneroll for longer periods of time, I have them lower their head support till eventually we can get their head all the way to the ground. If the patient is still talking or complaining about neck compression or neck pain when they're using this, a lot of times what they're doing is they're letting their head hyperextend, which puts a lot of compression at the base of the skull. So to avoid that, I teach my patients to slightly tuck their chin while lying on the Denneroll to avoid any of that upper cervical compression. When the patient is doing this at home, we're having them build up to 15 minutes daily. They're doing this on the floor, and they're not going to be able to just sit up after using the orthotic. So what we have them do is generally bend their knees and use their feet, and then we have them roll off of the Thoracic Denneroll on the ground. We instruct the patient to lay on the ground for a couple of minutes after using the orthotic before sitting up. Sometimes after being in that position for 15 minutes or so, the patient can experience some dizziness as they sit up, so we simply have them rest on the ground before they go ahead and sit up. Contraindications include most of our red flags, such as fractures, instabilities, canal stenosis, infections, or of course, worsening of the patient's symptoms. If the patient is unable to tolerate the thoracic unit, we can start them on the Thoracic Retrainer, which is simply a milder version of the thoracic orthotic itself. And this would be used for patients that are very hyperkyphotic, older patients, or patients that have very sensitive thoracic spines. Once they can tolerate the retrainer, then we can eventually progress them back to the Thoracic Denneroll. Every single unit comes with its own user guide. So the goal is to get the patient to do this for 15 minutes every single day, and the user guide teaches them how to build to that 15 minutes. If you have any questions or you'd like more information, please feel free to contact us.